I think as physicians, as pediatricians, we always want to have the answer. We want to be able to fix things. So we have patients that we have gotten to know that as we see them struggling more and more with their mental health, what you might have felt comfortable helping with prior, all of a sudden you're feeling more out of your comfort zone. And so you reach the limits of what you feel like you can help them with. MO-CPAP allows you to have somebody to reach out to say, here's what's going on, what can I do next?
The Missouri Child Psychiatry Access Project is really an attempt to help and serve youth who have mental health issues with the shortage of child psychiatrists. And many primary care providers, when they go through their training, they may not have a lot of exposure or education on mental health. So the benefit to MO-CPAP is that when you feel or if you feel uncomfortable and you need someone to help you work through how to assess and treat, you can call our number, talk with a child psychiatrist, and get that right away. We actually provide one-on-one consultation with primary care providers within a 30-minute window. We provide educational modules that are online that they can go and they can do and learn more about screening tools, diagnosis and treatment of common psychiatric disorders. And then in addition to that, there's linkage and referral. So if they, through either talking with a psychiatrist or they themselves know this child needs therapy, we can help refer them and link them to someone who can do the therapy. We've been able to add support coordination so that there's a coordinator who connects with families to make sure that they were able to get the resources that they needed.
For me as a rural provider, it really is a lifeline. It's my ability to get expert advice quickly, conveniently for my patients. We're very, very isolated. Many patients travel 60 miles of not so good roads or even longer to come see us for routine medical care. It's challenging for families. Oftentimes they try many, many things at home first, and when they finally make that decision, gosh, we've got to go see the pediatrician about this, they're close to the end of their rope. Many times if I do refer a child for child and adolescent psychiatry, it may be months before they have an appointment. Many families are not ready to wait 6 months anymore. Many families want an answer yesterday and they finally got brave enough to ask today. Once they make it to my office, they're hoping and praying for some sort of answer, some sort of resolution to the issue that they're dealing with. So having MO-CPAP child psychiatrists to help guide me really is a lifeline for both me and my patients.
MO-CPAP is really invaluable. I can't really think of a price I would put on it because it's just so critical. A lot of the patients that we serve, many are living in poverty. So we often have patients come to us that are in crisis, that need immediate intervention, and psychiatrists that we might want to try to refer patients to, they unfortunately may not accept Medicaid, and our patients certainly are unable to pay out of pocket. And so for us to be able to utilize MO-CPAP to get recommendations regarding medicine or to get them these interventions that they need here with providers that they already trust, it's just really invaluable, and everybody needs to know about MO-CPAP.
What I wish people knew about MO-CPAP is that it's so very easy to use, that I can schedule a call, that I can say, can somebody call me at 5:15 today, or can we do it first thing tomorrow morning? And I'm able to really devote time to that discussion.
I was so happy after the first time that I called because not only did I have one answer to that question, but then I had a plan B, C, and D on the what ifs, because we all know the what ifs happen. It's nice to know that down the road we have multiple options. And so I wish people knew how easy it was, how fast it can be, and that it's free.
Having access to the training modules, to the consult line, it really does bolster the confidence of our providers in being able to manage the patients when they come in with these conditions. It really helps in building that competence and that confidence.
And so when you're able to turn the corner with a teenager who's been struggling with depression, with anxiety, the first time that you see them back for a repeat visit and you see that light in them again and that sparkle, There are few better feelings that I've had as a pediatrician, and just getting to talk to them again about the things that they love and seeing that also in their parents' faces, and you know that they've really gotten their child back. It's one of the most rewarding feelings that I've had as a pediatrician.